Welcome to Business Line's State of the Economy podcast, where you'll find insight, analysis, and the story behind the numbers.
Hello and welcome to the State of the Economy podcast. I'm Jyothi Datta. It's being called the silver tsunami, the growing number of elderly people across the world, and indeed in India. In fact, in about 20 years, we are told the number of elderly people in the country are projected to outnumber the number of young children in India. But is the ecosystem really prepared to cater to this 149 million and growing population? Well, let's find out from Mr. Saumyajit Roy, the co-founder of Emoha. Now, Emoha is a 5-year-old firm that runs services for the elderly, including an emergency support system. So thank you, Saumyajit, for being here.
Thank you, Jyothi. Thank you for taking time out for something as important as this. Looking forward to a chat.
Right. So, the data points are quite staggering that in 20 years, there will be more elderly people in the country, that is people over 60 years, than those in the 0 to 14 years age group. So tell us more, the studies from, which organization and what are the projections they're making?
Sure. So a little bit about myself. It's been 15 years for me in the elder care space. I come from an urban planning background. And over the last 15 years, I have seen how in India, as we start talking about elder care, increasingly there is a lot of attention on how this important subject is touching pretty much every life, every home in the country. We have 140 million people in the country. What we forget is the fact that close to 340 million people are going to become elderly in the next 20 years. Honorable Prime Minister had created a plan which is called the Viksit Bharat program for 2047. The unique thing is 2046 is actually the year where this transition is happening, where we'll have more elderly than children. And this is a moment of time in history where we'll move from 1 in 10 in the country being elderly to 1 in 5 being an elderly. And it doesn't take lots for us to understand how will that world look like. If you just glance a little bit towards the east, look at the Japanese markets, look at the European markets, and these are markets which are already moving into 1:20, as in 20% to 25% population being elderly. And therefore, the amount of preparedness that India as a society needs to do to be able to take care of these macroeconomic trends of people living longer, people living till their 80s, 90s, with less, disposable income, with more, healthcare related challenges, with more hassles there, urban India with its challenges of crime and other issues. And most importantly, how do we leverage the power of having 140 million brains of the country being able to do something relevant for themselves and for the country? These are massive points which we need to introspect and think about.
Right. I mean, a lot of things that you brought up there. So looking at just healthcare in terms of support services, is the country prepared when you talk in terms of doctors or support staff who can handle ailments that are probably specific to elderly people more so, say, for example, dementia?
Yeah, so when we look at elder care, the specific topic that we have to think about is geriatric care. At Emoha, all of us in the founding team come from a background in elder care, and I think the geriatric care component is something that we end up missing upon. While hospitals have been taking care of ailments for the longest while, I think sons and daughters who have parents in their 60s and 70s needs to be able to understand that they need to do something about their parents, because onset of vulnerability starts early. No disease like cancer or any other issue like dementia suddenly props up. So the ability for us to take action when elders are in their late 50s and 60s and 70s, the young elderly phase as I call it, is the time for us to think, how can I do better care monitoring, geriatric management for the elder by virtue of having the clinical plans being prepared properly, regular checkups. It's just the rigor of daily care, rigor of monthly care, which ensures that the elder can age magnificently in the comfort of their own home. We don't have to wait for them to fall sick or go into advanced acute issues. There are lots of medical technologies, sensors which can stream medical data from the elder's home, a lot of tests and assessments, vaccinations. and various kind of opportunities available to make your home elder safe, which you can do today. And organizations like Emoha today exist to be able to make it comfortable in wherever the elder is staying. So while healthcare is a major challenge, the power for sons and daughters out there is to be able to take that action today.
True. So, in a previous conversation, you've told me that there is an opportunity for businesses to look at it, albeit with a heart. So, what is this opportunity, if you can, for existing and new entrepreneurs? And at Emoha, you've started a recent emergency, what do you say? You call it like
Once
for
secure.
elderly people, even on the go, they can stay safe. And a particular service that you brought. Maybe you can expand on that as well. So other entrepreneurs can get an idea of the kind of things that they can do.
No, Jyoti, I think this is a very, very opportune sector. Many years back, the edutech sector or the health tech sector came up. Worldwide, the age tech sector is a multi-trillion-dollar economy. And why not? When you have, 140 million people, let's say 40 million of them in urban areas, they spend money. It's not just their, needs. Many of them have desires, and culmination of all of that makes a fairly large economy of people who are willing to spend money, who have the needs for more safety, more health, more hassle-free life, and most importantly, something they want to do. And this silver economy, as I call it, is has the ability to involve multiple stakeholders, whether it's the healthcare ecosystem, whether it's the diagnostic ecosystem, whether it is the financial ecosystem. Banks can do more, insurance companies can do more, the real estate companies can do more, the legal systems can do more. There is enough and more opportunities for ecosystem players on the pharma side, on healthcare side, to participate with companies like us, to be able to provide a one stop for an elder wherever they are. The reality is the new age elder in their 60s and 70s are asking for products which are better designed, better customer experience, and so on. And that's the pleasure I have to have partnered with SIS Group for the We Protect, solution, which is a pioneering solution. And SIS is the country's largest security company, the largest alarm monitoring and protection company, with whom we are doing a pan-India solution called One Secure. And this is the ability for us to be able to have elders wherever they are on the go, traveling, to be able to just press a panic alarm button and be able to get emergency response from SIS and Emoha, and also have an Emoha daughter keep a regular check on them. Small things, but these small things can save lives and help elders when they need the help most.
Yes, you did narrate an incident of a person who was going into a stroke, but the family hadn't recognized those symptoms, and I think the support system had sort of picked it up and urged them to go to a doctor.
Correct.
Right.
So this was very interesting because this is one of many such instances. Over the last several years, Emoha has now been able to save more than 1,000 lives in close to about 120 cities and towns that we are present. Many such incidences happen, but happy to share one which was like 11 o'clock in the night, and an uncle of ours who stays in Gurgaon had a pain on his chest, and his family was like, this is just a normal, like a pain that would happen because of food or whatever. But because he's a member, he called on the emergency line, and our doctors who are there 24/7 were able to figure out that this is something which is, not just a normal pain. And we were able to triangulate it, triage it, and then get him to be evacuated to the nearest hospital. It happened to be a stent that got operated, late in the night. And today, uncle is absolutely fine. And this is 2 years back. So the reality is, my friends, that 25%, 1 in 4 elders have a fall, as in they literally have a fall on the ground, and that starts the beginning of a long decay process. 2 out of 4 have loneliness related issues, and 75% elders have healthcare issues. So the earlier we are able to get control on your parents and take that responsibility seriously, the better it is, because the later periods could mean more expenses, more pain, more challenges, and so on. So today, organizations like us can actually bring a surround sound for your parents, so that they can actually enjoy life and not go through such kind of pains.
Right. So we've seen, so this is as far as your support services are concerned. We've seen recently there's been a move asking insurance companies to provide, health insurance for those over 65 years. And while that's good and it's taken a long time coming, among the products that we do have, one sees with the elderly, the premiums are really high. Now, even for all of these services, I understand that we're talking of paid services here, but how does one look at both to give a service as well as to keep it friendly for a pensioner, who may need the support?
Again, Jyoti, it's an area of massive interest. Must complement the idea for taking a lot of interest in making that health insurance for elders becomes more and more accessible and affordable. Again, at Emoha, very proud to share that the Aditya Birla Health Insurance, which has come together as a strategic partner, ABHI and Emoha are evaluating opportunities to be able to showcase solutions which can make it affordable for sons and daughters who, for example, would have purchased a health insurance from Aditya Birla and be able to get a rider or get a top up, which is parental benefits from Emoha. So today, health insurance companies obviously have fairly expensive senior care solutions, but we see the next couple of years being transformational for being able to provide interesting outcome-oriented solutions where we can help an insurance company save their losses. So with 2025 health insurance companies out there who have a fairly large book of people of their insured who are elderly, the challenge is data. The challenge is there is no comprehensive local data, longitudinal data on aged care, and that's the reason why premiums are so high. So as the market becomes more aware of the needs and then more elders sign up, and we have a better system of monitoring day-to-day care expenses, the cost of being able to provide such opportunities will come down. So while it is true, Jyoti, that the prices are high today, but I actually see transformative innovations possible with like-minded thought leaders like ABHI, who, along with aged care specialists like us, can work together to create innovative new age products, much the same way it is there in other parts of the world.
Right. So we do see, some projects which are catering to the elderly cropping up across the country. Now we'll have to watch that space a little longer. Now,
Yeah.
are there other best practices in, other parts of the world that India can look at and adapt into the local ecosystem, whether it's on a social services support or a single call for on an emergency? Any that you think that can be picked up?
So to give you a sense, there are 33,000 senior living facilities in the United States alone. India doesn't even have 100. So whether it is the ability for us to create senior living facilities where elders can move in and stay and have an enjoyable life, Emoha is fortunate to have as part of its platform, the aged care platform, a sister company which is called Epoch Assisted Living, which is again specialized in dementia care and has homes in Pune and in Delhi, headed by Neha Sinha, who's the CEO there. The world has seen a lot of innovations in both sides, at both services at home, where elders stay in their own home, it's called Age in Place, and also services and innovation in the hub, where elders are moving into a facility. We will see both these spectrums coexist and grow in a dramatic context. And the innovation lies in the transition. So we see the possibility in India to not copy the West and create another, like CCRCs, continuing care retirement communities in India. We see the possibility of using best of technology like how Emoha is built on and be able to stream in services at home, but at the same time create transition facilities where like a daycare model where elderly could spend the day in a club context doing things, learning new activities, contributing to society, maybe going to an NGO while still staying in their own home. So the ability for us to, much the same way as the fintech revolution happened with UPI, I think in India we can jumpstart and do innovations on the aged care space so that elders can stay in their own home, and using remote patient monitoring and various other healthcare technologies, we can stitch, the hospitals, the home, insurance companies together, and those innovations can help us find better solutions for aged care in India than what is there abroad.
Right. So, we have a new government and then, they're likely to present their budget soon. So, what would be your ask for the silver generation?
So first of all, would like to compliment the government for having kept the focus on senior citizens. The Ministry of Social Justice and Empowerment over the last many years, and I have been actively involved with them, have done several initiatives for this segment. But specifically for the budget, I think it's extremely important that that the government recognizes that this is a space which should be given pretty much like an infrastructure category, with some degree of tax benefits being given to consumers who are out there. Somebody who's paid income tax for 30, 40 years, if there is an ability for such people to have relaxations on GST or on their income tax segments, can go a long way in ensuring that senior citizens who today are not earning any money can have a more long-term stay for their equity. So specifically GST reductions on elder care services or products, and income tax related support for senior citizens, particularly senior citizens who are 75, 80-year-old and beyond, are something which will increase affordability and accessibility for senior citizens.
Yes, let's hope someone is tuning in and will hear you on that. So, and that there are many more conversations that are generated on this very significant segment of our population.
I think it will, Jyoti, because the manifesto for both the governments who contested had elder care as a very prominent part of their manifesto. So I'm actually quite bullish that this government will see a lot of, infrastructural creation for, for the elderly segment, almost like a UPI equivalent aging stack for the country.
That's an optimistic note to end this conversation on, Saumyajit. From the BL team and myself, thank you so much for your time and your insights.
Thank you. Thank you for taking this up. This is something that every son and daughter out there should think about their parents. We are what we are because of our parents, and we should do a little bit to make their life more happy. But thank you so much.
Thank you.